Thank you. Next.
Hello. My name is Mary Armstrong. I am an IHSS provider and a member of the UDW Union. I live in Modesto, California, which is in this county of Stanislaus, where I take care of two people. Both are blind, and they live alone. And I can say one check was late, more than one, but the main problem is I haven't been paid, and I've worked for one of my clients for an entire month, and due to paperwork and red tape, whatever they're doing, they didn't get her back in the system. So as of today, I am still working for her. She's also diabetic, and she's on dialysis, so when her hours stopped, I couldn't stop working for her. I continue to care for her as of this day, but as of this day, which is the end of the month, I haven't been paid for this month at all. And the first 2 weeks, and I haven't received timesheets for the last 2 weeks. Thank you.
Thank you. Next.
Good morning. My name is Pamela Jones, and I am a member of UDW. I live in Calaveras County, which I have a client there, and I also work in Placer County. Numerous times, I've not even gotten a time card for 30 days plus or a paycheck. And I strongly urge that you audit this program and get it fixed. Thank you for your time.
Thank you. Next.
Hi, my name is Crystal, and I have 4 caregivers. I'm from Butte County. I got involved when my caregivers didn't get their checks. Their checks were delayed a full pay period. Then they stopped getting their time cards. They contacted payroll. I eventually contacted payroll. After 3 calls, I finally told them, hey, I'm coming in to pick up my caregivers' time cards. They were 3 and 4 pay periods behind. One of my caregivers is still trying to get paid for January. When my caregivers don't get paid, I lose caregivers. I've got 2 caregivers that won't work until they get their paychecks, and I don't blame them. They got families to support, they got bills to pay. This needs to be resolved. I depend on my caregivers. They're not a luxury, they're a necessity. Thank you. Please, please. We're looking to you to solve this, please.
All right.
Thank you. Next.
Good morning. My name is Jeannie Rezebek, and I'm an IHSS worker in El Dorado County and also a UDW member. There's two problems here with the checks. First of all, it's time card problems, the tardiness of them getting to the provider. Secondly, the actual process in itself of the checks. I've had to wait 6 weeks for 3 checks that were backlogged because of a time card problem. So I really hope that you guys can go forth with this audit. Thank you very much.
Thank you. Next.
Good morning. My name is Naisha Brown. I'm from San Francisco, California. I am a in-home care provider. I have been working for the past 4.5 years, going on 5. Basically, my 2 issues regarding payroll, again, piggybacking on the young lady here, being on time. If we're turning in our timesheets, on a certain date, and we expected to get it in 10 days, we shouldn't have to wait for 6 to 8 weeks to receive it. I just quit one of my jobs working with a client because of an issue of shared costs. Come to find out that the shared cost was not her issue. It was Medicaid made a mistake of following her paperwork. So now it pushed me back of receiving my money, but I'm still waiting on my check. I did quit working for this lady because I didn't want her to have to pay out her pocket because of a fixed income. So, fortunately, I don't work for her. I'm still waiting on my check. When you try to address these situations with the finance department, you get the runaround. They tell you, we don't have enough people working. Well, hire somebody else. Hire more people. We want to get paid on time as well as the state workers. Thank you.
All workers.
Thank you. Next.
Good morning. I'm coming from San Jose. My name is Angelica Salinas. I had the same problem, and I support because I was in the same situation that the other persons talk. So I support the. Thank you.
Thank you. Next. Is there any other members of the public who would like to comment? Seeing and seeing none. Senator Levy, you had a question?
Thank you, Mr. Chair. I actually don't have a question. I'm wondering if maybe we as legislators should organize a little field trip and go over and see why this is happening. This is absolutely appalling. I come from the private sector, and when someone wasn't paid, the company had to do a paid out for them right then and there. So maybe we need to teach the state to do a paid out, or maybe the folks in charge should lose a couple paychecks until they get it fixed and they can figure out what it's like to not have your paycheck and not be able to pay your bills. I can't even believe that this is happening. The 40,000 that were lost, oh my God. I just came from a meeting where we were talking about homelessness, and one of the issues I brought up is making sure people had good jobs, and that helps with homelessness. Well, when you have a job and you don't get paid, that attributes to our homeless problem. So whatever I can do personally, whatever we can do to make this happen immediately needs to happen. This is shameful for anyone who's in elected office. And you guys who work there, I don't know you. I've never met you until today, but you should be very embarrassed that this is happening. I'm sure you guys haven't missed any of your paychecks. Thank you.
Senator Roth, question?
For the state auditor, but I guess first, I fully intend to pursue the oversight issue. I don't know whose budget subcommittee has it. I'm not sure that it's the one that I chair, but I'm going to find the one that has jurisdiction over this, and we'll figure out how to organize an oversight hearing unless the agencies manage to fix it before we get that on the docket. But having said that, Madam Auditor, this is not the usual audit that we hear here. And the usual audit, of course, takes whatever the audit takes in order to get it accomplished. I'm just wondering if there's a way for you and your team to somehow expedite this audit, given the fact that we have people's pay, in some cases their health and their livelihood at stake. So if you could consider that, I would appreciate it. And Mr. Chair, I'd renew my motion and also my request that this issue be referred to the appropriate policy committee for review.
Assemblymember Jones had a question.
Thank you, Mr. Chair. Ms. Gonzalez, are most of the IHSS workers, or maybe all of them, are members of a particular union? I think some of them mentioned that today.
Two different unions.
Two different unions. Okay. What is the? Can you comment on what the unions have been doing about this? It seems kind of like, there should have been some oversight from them as well prior to rising to this level of concern.
I just, and I want to remind the committee, I actually brought this to the union because my cousin had a problem, and we solved it for her through calling the state. And that's when I realized they absolutely said, yes, this is a huge problem. We've been trying to work on it. But I want to remind you that these unions have been trying to work on a ton of issues with this administration, have been trying to get a lot of things for their members and continue to try to. So when you're in the middle of bargaining with somebody who does not, quite frankly, the governor does not want to do any more and is brought along kicking and screaming when it comes to our in-home support service workers, it's like the litany of issues that they face. It's one of many. And I just thought that, like all of you, I was outraged. Having come from organized labor, obviously we know in the private sector, we would be picketing and demanding and throwing people in jail, over the type of mass wage theft that has gone on in this program. But the union both unions have so many issues that they're fighting for with this governor. It has been brought up, and I think that their frustration has been like, okay, we've got to work on this as well. It's one of many issues, and so I said, well, let's at least pursue this through an audit.
Well, I certainly agree with the comments that have been shared by the other members of the committee, and I think in a situation like this, the negotiations with the governor and the administration, that's one level of conversation, but when you're talking about people's basic income, and that's what they're counting on, I think that rises to a higher level of scrutiny, and I'm hoping that, obviously we've got movement here, but I'm hopeful that the unions will do their part as well in helping out. So
I'm going to defer to the union, one of the union reps who are here, because
okay, thank you.
I in no way am suggesting that the union has ignored this issue.
Hi.
Nor am I.
Okay.
I just want to. Okay.
No, I just want to. I'm Kim Rutledge. I'm with UDW, and I'm speaking on behalf of both of our labor organizations, UDW and SEIU Local 2015. We actually, after the incident in Los Angeles County this time last year, where the 40,000 timesheets went missing, we were in really direct conversations with the Department of Social Services and the Office of Systems Integration, because that was sort of the wake-up call. Even though we had been going back to 2013, and even when the CMIPS 2 system was rolled out, and even before that, dealing with a lot of delays, we really, after the 40,000 timesheets went missing, that's what really was a wake-up call, I think, for the Department of Social Services. And initially, they were very open to talking to us about looking to solutions, including possibly coming up with an electronic timesheet system, or something that would maybe move away from having to rely on the Postal Service and having to rely on 3 different state agencies and a tech vendor just to get a paycheck out to a provider. Those conversations were actually fairly informative, and we were making some progress until October, when some other issues around the Fair Labor Standards Act, overtime pay came up, and DSS just basically dropped all of our discussions at that point to concentrate on some other issues. And at that point, that's when we kind of ramped up our conversations with Assembly Member Gonzalez about doing an audit, because they all of a sudden were like, oh, well, we have too many other IHSS issues to work on to really look at this right now. We're going to have to delay it indefinitely. And from our perspective, I mean, these are our providers, as you've heard all morning, not getting paid in a timely manner. And even though we understand we've got a lot of other issues that we're coming to, this is a complex program, and we can't have people caring for our most vulnerable Californians not getting paid on time. Also, I want to just briefly back up Senator Leva's comments about maybe taking a field trip to look at the system. I actually have gone on that little field trip to the timesheet processing facility in Chico. It is a 2-building facility that you see firsthand how these timesheets go through. And if an envelope is too thick, like if you put something other than just the timesheet in your envelope, the system spits it out and it has to be manually processed. If you use blue ink or red ink or any other color of ink other than black, the system doesn't read it and spits it out, and it has to be manually processed. And all of these things, when you start looking at it that way, add up to delays. And it's 2016. I mean, we would think that everybody has a smartphone at this point. And you would think that there would be a way for someone like Ms. Kaufman not to have her pay delayed because the system couldn't read her writing, or somebody not getting paid because they picked up a blue pen instead of a black pen. I mean, who's even heard of such a thing? So the trip to Chico that I took last summer after the 40,000 timesheets went missing was really, really enlightening, and I think it would be well worth any legislator's time to see that firsthand, because it's a really interesting look at the way the system works. So thank you all very much.
Senator Gojani had a question before we move forward.
It's a comment and a question. So I wonder how much of this is systemic and how much of this might be that there are a certain number of specific employees whose performance is lackadaisical, less than should be expected. I'm wondering if the way that the audit request has been written, will it tell us that? Will it point to whether it's how much of it's systemic and how much might fall on a specific group of employees that are not carrying the load that they should carry?
Well, the objectives don't specifically ask us to look at employees. Anytime we conduct an audit like this, we will be looking at process, but when we're trying to determine the cause or the reasons for the delays and the problems, we would potentially get to an issue as to do they have sufficient number of employees? If the employees are having trouble dealing with the system, why is that? Do they not receive sufficient training, that sort of thing? So I don't know that the audit would specifically say these 3 employees are problematic. It would look at the system, and then it would determine whether or not, again, if a lot of it is a manual system, why is that, number one? Number two, how many staff are working on the manual portion of the system, and then what type of training, et cetera, has been provided to those particular employees. So it would get at it from that perspective.
Well, in the private sector, in a situation like this, people would probably be fired. So what I'm suggesting is that if it appears that it's specific employees that are not showing up to do their job, that are not performing as they should, that maybe some people should lose their jobs if they can't do it right. So I'm hoping that the way this is written, it will show us how much is systemic and how much is actually problems with employees that are currently performing the jobs.
Okay, with that, Assemblymember Wood, so we can move forward. Question?
Yes, I just want to thank you again, Assemblymember Gonzalez, for bringing this here. And I want to thank the witnesses for coming, because I know it's a hardship. These folks have taken time off, a day off probably, that they're not getting paid for, and to be here, and they shouldn't be here. They should not be here. I come from the private sector too, just like Senator Leyva, and I know others out there. And I can tell you, we in the private sector, when it comes to pay, we are very, very serious about that. The last thing I want is the state coming down on me for not timely doing something. So we had a person dedicated to dealing with those kinds of issues year in and year out. So why do we, as a state, not extend that same courtesy to people that we are employing here? And that is absolutely the only word that comes up is completely unacceptable. Unacceptable.
Mm-hmm. Okay, with that, Assemblymember Gonzalez, would you like to close?
Well, I'm in an odd way very excited that everybody is as outraged, because sometimes I think my outrage is just me being outraged at the system. But I actually think that this is good. And we can do productive things, because this is one problem that IHSS workers are facing. We have a society that is aging quickly. We know that healthcare is expensive. We actually save the state money by having providers and people be able to stay in their house. It is it's a costly program, but a program that ultimately saves the state money. And yet they are constantly treated like second-class citizens, constantly having to fight for the very basic rights that we suggest everybody should have in the private sector. I've been outraged. I know a lot of people on this panel have done work on this as well, and I think we should have an oversight hearing. I'd love to join any of you on that, and on that quest and on a field trip. But I do want to I want to remind folks as we move forward, this is one of many problems that IHSS workers face, and one of the many ways that they're discriminated against, quite frankly, by the state. They are doing us a service. They are saving us money, and I think that can't go understated. So I respectfully ask for your aye vote on this audit, and to continue to work on this and the other issues that our providers face.
Thank you, Assemblymember Gonzalez. After obviously hearing all these issues that brought to our attention here, I'm a strong yes on this audit. And I can't believe that this is happening at this day and age, where we have technology, we have everything to supposedly address these issues from occurring, but it's still occurring. So members, a strong yes. Hopefully I can get your support as well. So is there a motion and a second to approve audit 2016-128? I believe there was, right? Do a roll call, Secretary.
Assemblymember Rodriguez.
Aye.
Rodriguez, aye. Ashajian.
Aye.
Ashajian, aye. Arambula.
Aye.
Arambula, aye. Baker.
Aye.
Baker, aye. Jones.
Aye.
Jones, aye. Nazarian. Wood.
Aye.
Wood, aye. Senator Roth.
Aye.
Roth, aye. Bell.
Aye.
Bell, aye. Galgiani. Galgiani, aye. Lara.
Aye.
Lara, aye. Leyva.
Aye.
Leyva, aye.
That motion passes 11-0. Thank you, Senator Gonzalez.
Hey, I have to sit here for hours.
I'm not going to say what I was going to say. Mr. Chair and members.
Senator Laura, we have your item 2016125, University of California.
Thank you. Thank you, Mr. Chair, members. I'm asking for your support of this audit request to review the contracting practices of the University of California and to compare the pay and benefits of the UC employees with contracted employees performing the equivalent work. Over the past 2 years, I have worked on legislation to address the increasing use of contingent workers to replace employees at the University of California and the consequential negative effects it has on wages and worker protections. In order to give our governor and members of the legislature an accurate and detailed analysis of the fiscal impact of these bills, it is important for us to have a side-by-side comparison of the compensation offered to workers. This audit will also review contracting practices at the UC, including the IT project UC Path, which has run into significantly over budget and behind schedule. The auditor will examine the contracting policies and procedures at the UC and ensure that they follow the best practices. Hopefully, the findings from this audit can help the UC overcome challenges, reduce contracting costs and delays, and provide the legislature an important cost analysis on service contracts. I respectfully ask for your aye vote.
Thank you. I have witnesses that would like to testify in support. You can sit at the table if you'd like to testify in support of the bill. Okay.
Liz Ortega with AFSCME 3299 here in support.
This isn't public comment. This is testifying in support. If you'd like to sit at the table. We haven't had public comment yet. Okay. Senator Lar, do you have anybody?
No, we're good.
Okay. With that, is there a representative from the affected agency who would like to come? I'm sorry, before we get that, Auditor, can you go ahead and with your presentation on the audit, but you can still have a seat at the table, yes.
Certainly, Mr. Chair, thank you. As Senator Lara indicated, this would be looking at University of California and a selection of campuses. We believe we would need to go out to campuses to conduct some of these objectives. But the first step would be to look at contracting policies and practices. Are they complying both at the UC, UCOP level, Office of the President, and at the respective campuses that we visit? Are they complying with federal, state laws, any regulations, and certainly best practices with respect to procurement? Senator Lara is very interested in looking at a selection of service contracts and determining, again, with respect to service contracts, compliance with the same thing, laws, regulations, any policies that have been established by the system. He's also asked us to look at a 5-year window and look at the past 5 years and, to the extent we can, identify by category the types of contracts, procurement methods, and the goods and services that the UC has purchased via contracts. In the background materials, in the analysis, we talk about the fact that over a course of a year, it's in the billions of dollars, upwards of $7 billion. So he's asking us to try to break that down by various procurement methods. But this audit is specifically really looking at service contracts. So the next objective is specific, again, to service contracts and to try to compare service contracts and the compensation and benefits provided to employees under contract versus UC employees as far as individuals who are in comparable positions. So looking at service contracts, perhaps janitorial services, and determine whether or not UC employees are paid more or less than contract employees and what's the impact on a per employee basis. In addition, he's asked us to look at some technology contracts and how UC is managing those contracts, and specifically asking us to look at oversight. What kind of oversight does UC provide for IT contracts? And he has asked us to specifically specifically look at UC Path, which is a IT project that was intended to be rolled out to all of the campuses. Our understanding at this point in time, it's been rolled out just to the Office of the President, hasn't been rolled out to the other campuses yet. It is behind schedule and has gone over budget, so he's asking us to look at the reasonableness of those increased costs and the delays in the schedule. Also asking us to determine whether or not information has been shared with the Board of Regents so they are fully informed with respect to this particular project. And then the last objective related to IT contracting practices is what are they doing to address any challenges that have come up not only on the UC Path project but on other projects as well. The budget is 3,200 hours. The reason it's that high is because, again, in discussing this with our team that worked on the last UC audit and trying to understand how contracting works, we think a lot of this work will be done out at a sample of campuses in addition to doing some work at the Office of the President. So with that, it would take about 8 months to complete an audit of that size.
Okay, thank you. Agencies affected?
Chairman
Brief
Rodriguez
comments?
and Vice Chair Roth and members of the committee, Steve Juarez with the University of California. I'm joined today at the table by Jason Murphy, who handles issues in this area relative to government operations or UC operations. And so we're here primarily to answer any questions you may have relative to the audit. We believe we're an exemplary both executor and manager of contracts, but we're always happy to collaborate with others, including the auditor, and hopefully shine a light on what we believe is a very good practice. So with that, we'll turn it back to the committee.
Any other members comments? No? Any questions by members of the committee? Senator Roth.
Yes, Mr. Chair. You know, it was my understanding that that UC had just completed, and I thought it was successfully, a compensation, wage and benefit IT system. Can you tell me what the status of that is?
Are you referring to UC Path?
Is that what UC Path?
Yeah, UC Path, which is actually located down in your district, down in Riverside.
I know where the building is. Right?
And the auditor is correct in that right now we're at a stage where we've fully brought on the Office of the President. The idea is over the next 2 years we'll then get all the 10 campuses and the medical centers also on UC Path. I just want to say, to be clear, it is not an IT project per se. It started off as a merely replacement for our existing system, which had basically 11 different systems trying to come together to speak to one another, which was next to impossible. What ended up happening in the course of reviewing and starting the project, we realized it couldn't be just an IT project. It had to be a whole business practice revolution. And so what happened was that we recast the project so that in fact was more than just replacing the existing system. And it's well underway. We think we're going to achieve something that, quite frankly, the state hasn't been able to achieve, which is to implement a full-scale project across our entire system that will look at personnel, payroll, administrative practices, and incorporate that all into one system.
Thank you for that explanation. As you know, I've had a little bit of experience with state payroll systems now, IT systems, whether I wanted to or not. So I look forward to the results of the audit. And, Madam Auditor, to the extent that you discover any best practices in your search through the UC effort, I hope that you will identify those in your audit report, because we need to spread that around to other agencies in the state. Thank you, Mr. Chair.
Any other questions, members of the committee? Seeing and hearing none, is there any public comment by members of the public? Please state your name. You have 2 minutes. Public comment.
Michael Young, on behalf of the California Labor Federation, I would like to thank the member, Laura, for bringing the bill or bringing this audit. We think it highlights a very necessary concern, and we actually want to align our support for the audit. Thank you.
Thank you. Next.
Liz Ortega, AFSCME 3299, here in support of the audit.
Any other members of the public? Seeing and hearing none, Senator, would you like to close?
I respectfully ask for your aye vote.
There's a motion and a second. I'm also requesting a yes on this audit. Secretary Calderon. On 2016-125, University of California.
Assemblymember Rodriguez.
Aye.
Rodriguez, aye. Ashajian.
Aye.
Ashajian, aye. Arambula. Arambula, aye. Baker. Baker, aye. Jones. Jones, aye. Nazarian. Nazarian, aye. Wood. Senator Roth. Aye. Senator Roth, aye. Galgiani. Lara. Leica. Oh, I'm sorry. Is that Laura? Sorry.
Laura said, yeah.
Oh, I'm sorry. Laura, I. Leyva? Leyva, I. Galgiani, I.
That motion is out, 10-0. Thank you very much.
Thanks.
Secretary, I think we had somebody wanted to add on.
He did already.
Oh, I think he already did.
Yeah.
All right, so meeting is adjourned. Thank you.